In this video, we will discuss about carpal tunnel syndrome. First of all, we discuss what is carpal tunnel syndrome. Carpal tunnel syndrome is an entrapment neuropathy caused by compression of median nerve as it travels through the wrist carpal tunnel. It is the most common entrapment neuropathy, accounting for 90% of all the neuropathies. Clinical relevant anatomy. Carpal tunnel is formed by non-extendable osteofibrous wall that forms the tunnel protecting the median nerve and flexor tendons. Transverse carpal ligaments flexor retinaculum makes up the superior boundary and the carpal bones form the inferior border. Next we will discuss about etiology. The prevalence of carpal tunnel syndrome is estimated to be 2.7 to 5.8% of the general population, with a lifetime incidence of 10 to 15% depending on occupational. Carpal tunnel syndrome usually occurs between ages 36 and 60 and is more common in women with a female to male ratio of 2 to 5 ratio 1. Next we will discuss about pathophysiology. Pathophysiology depends on three factors. Number one is decrease in the size of carpal tunnel due to mechanical overuse, osteoarthritis, and trauma. Disease states leading to augmentation of carpal tunnel contents include masses such as ganglion or cyst, deposition of the foreign material such as amyloid, and due to synovial hypertrophy. And number third factor is compression and traction, in which obstruction of venous overflow with increased edema and repetitive traction and wrist motion exacerbate the negative environment. Clinical presentation. Patient presents with tingling or numbness in median nerve distribution, weakness or atrophy of the thenar eminence, aggravation of the symptoms with static gripping, and loss of grip and pinch strength. Differential diagnosis includes other median nerve entrapment syndrome, pronator teres syndrome, anterior and trochleus nerve syndrome, and cervicobrachial syndrome. Diagnostic procedures include ultrasound, MRI, and electromyography and nerve conduction studies. Physical examination includes carpal compression test. For carpal compression test, apply firm pressure directly over the carpal tunnel for 30 seconds. Test is positive when paresthesias and pains reproduce. Another physical examination test for diagnosis of the carpal tunnel syndrome is Phelan's test. Fully flex the wrist by placing the dorsal surface of both hands for 60 seconds. Positive test when symptoms reproduce. Another test is reverse Phelan's test. Extend the wrist by placing the palmar surface of both hands together for 1 minute. Positive test when symptoms reproduce. Management includes medical management, surgical management, and physical therapy. Medical management includes the use of oral steroids, corticosteroids injection, NSAIDs, diuretics, and supplements of vitamin B6. Surgical management includes the release of carpal tunnel by orthopedic surgeon, and it is considered as a minor surgery. Physical therapy includes workplace modification ergonomically and certain manual therapy techniques, which includes mobilization of soft tissue, carpal bones, and median nerve, and splinting is also done. Thank you.